Hi everyone, welcome back to my YouTube channel. In today's video, I will be talking about the portion of calendar year 2024 CMS proposed rule that pertains to the Home Health Quality Reporting Program. Let's get started. CMS is proposing the adoption of the following measures. COVID-19 vaccine. Percent of patients/residents who are up to date patient/resident COVID-19 vaccine measure to the Home Health Quality Reporting Program beginning with the calendar year 2025 Home Health Quality Reporting Program. CMS also proposes to adopt the Functional Discharge Score or DC function measure to the Home Health Quality Reporting Program beginning with the calendar year 2025 Home Health Quality Reporting Program. The COVID-19 vaccine measure continues CMS's commitment to promoting the uptake of the COVID-19 vaccine and ensures alignment with current CDC guidance. CMS is proposing the removal of the following measures. With the addition of the discharge function measure, CMS proposes to remove the application of percent of long-term care hospital or LTCH patients with an admission and discharge, functional assessment, and a care plan that addresses function, application of functional assessment/care plan measure from the Home Health Quality Reporting Program beginning with the calendar year 2025 Home Health Quality Reporting Program. Additionally, CMS is proposing removal of two OASIS items no longer necessary for collection, the M0110 episode timing and M2220 therapy needs items. CMS is proposing the public reporting of four measures: discharge function, transfer of health information to the provider post-acute care measure or TOH provider, transfer of health information to the patient post-acute care, and COVID-19 vaccine percent of patients/residents who are up to date. CMS is also proposing technical changes to Part 484, Section 245B to codify their requirement that home health agencies must meet or exceed a data submission threshold set at 90% of all required OASIS and submit the data through the CMS designated data submission systems. CMS is also seeking input on future Home Health Quality Reporting Program measure concepts and providing updates on Home Health Quality Reporting Program health equity initiatives. Expanded Home Health Value-Based Purchasing or HHVBP model. Applicable measure set used in the Expanded Home Health Value-Based Purchasing or HHVBP model. For the expanded HHVBP model, CMS is proposing to codify in the Code of Federal Regulations the measure removal factors finalized in the calendar year 2022 Home Health PPS final rule. CMS is also proposing to replace the two total normalized composite measures for self-care and mobility with a discharge function score measure effective January 1, 2025. CMS is proposing to replace the OASIS-based discharge to community or DTC measure with a claims-based discharge to community post-acute care measure for home health agencies effective January 1, 2025. CMS is proposing to replace the claims-based acute care hospitalization during the first 60 days of home health use and the emergency department use without hospitalization during the first 60 days of home health measures with the claims-based the potentially preventable hospitalization measure effective January 1, 2025. CMS is also proposing to change the weights of individual measures due to the change in the total number of measures and beginning with performance year calendar year 2025, CMS proposes to update the model baseline year to calendar year 2023 for all applicable measures in the proposed measure set, including those measures included in the current measure set with the exception of the 2-year discharge to community post-acute care measure, which would be calendar year 2022 and calendar year 2023. Appeals process. CMS is proposing to add an additional opportunity to request a reconsideration of the annual total performance score or TPS and payment adjustment. Public reporting update. CMS is including an update to remind home health agencies and other stakeholders that public reporting of HHVBP performance data and payment adjustments will begin in December 2024. Health Equity Update. CMS is including an update on health equity to let stakeholders know that CMS is committed to developing approaches to meaningfully incorporate the advancement of health equity into the expanded HHVBP model. As CMS moves this important work forward, CMS will continue to take input from home health stakeholders and monitor the application of proposed health equity policies across CMS initiatives such as proposed payment adjustments in the hospital and SNF value-based purchasing programs. At this time, however, CMS would like to give home health agencies time to learn the requirements of the expanded model, gather at least 2 years of performance data, and study effects of the expanded model on health equity outcomes before incorporating any potential changes to the expanded model regarding health equity. This is it for today. Thank you for watching. If you enjoyed this video, please consider subscribing to my channel. Hope to see you next time. Bye now.